I want to thank all of our speakers for starting the day off in a terrific way. This was a wealth of information. Some of it was quite depressing, okay? Learning about the fundamentals of exposure and hazard and risk, and it was a bit scary. But then we started moving on into, well, how does that help us make decisions, and what are the emerging and existing tools that help us make those decisions? And we not only learned a lot about what the current state of knowledge is, but we also learned a lot about what the remaining questions are, and there are many. And so we want to use these questions to guide the discussion, and you may have some of your own. Now, a couple of logistics. One is that David told me that since they didn't work into the schedule the amount of time for that wonderful exercise we did, that we are being given a little bit more time. So if I go beyond when the original break was scheduled, I've gotten permission from David, and what he says goes. The other thing I want to emphasize is the rules of engagement for today. And you've heard that before, so I just want to reiterate. We have an amazing audience today, and all of you have something significant that you can contribute. But the way today is going to be successful is if we all respect the previous requests to keep your comments and questions brief so that we can hear from a lot of people, and our panelists have also agreed to keep their responses brief as well. So your questions and comments can be directed towards a particular panelist, or you can express it in general, and then they're going to fight over the mics, and they know that not all 5 of them get to answer each question. So with that, thank you again, and let's open things up. And do we have mics to move around? I'm going to go to the far back there. I saw your hand first. No, you're in the gray.
Hi, good morning, and thank you. This is a question for Russ. And we've also had a request, not only state your name and where you're from, but even though you're addressing the audience, if you can address the camera, however awkward that is, turn 180 degrees with your question, that'll make the archive so much more interesting. Hi there. I'm Alexandra Cosmides with GSA, the General Services Administration, and it's a question for Ross. You said that information from the HPDs flows into databases like Cradle to Cradle. Can you explain the relationship between the HPDs and the EPDs? Does some of the HPD information flow into the EPD information, and how do the two talk to each other?
And I'd just like to add, in the interest of minimizing acronyms that we're all familiar with, so we've defined that the HPDs is the Health Product Declaration and the EPDs are the Environmental Product Declaration. Both are part of this transparency movement to get manufacturers to state what the impacts of their materials are. Russ.
The two.
You have to push the button.
The two blind spots in the environmental product declarations are human toxicity and habitat biodiversity issues, which are actually, interestingly, the way LEED is now addressing materials has separated those out into 3 pieces: the human toxicity piece, the EPD piece, and the environmental health piece. So there's very little within an EPD having to do with toxicological understanding of material ingredients, and so there's almost no dialogue actually between an EPD and an HPD. The HPD is filling a hole effectively in the EPD.
Great. And then from this side? Yes?
Where are we going to?
So I stand and look at the camera. Is that what I do? So I'm going to ask
yourself to the camera, and then.
Okay, my name's Ken Geiser. I'm from the University of Massachusetts at Lowell. I guess that's fine. So I just want to say, Gail started off saying, well, there's a lot of dismal stuff here, but the way I'm seeing this, both for designers and for those of us who come out of a health background or health professional background, I think there's a huge amount of opportunity here. And the opportunity and the reason I want to lay it out that way falls on the thing that Charlene mentioned, is traditionally what we've thought about with hazards is how do we contain hazards in a design building or something like that. And I think the reason why I was frowning when you said that is when you put the hazard into a wall, you're changing the exposure of it. That's the traditional design way to think about it. It's not a good example of it. There are ways to think you can use exposure. But what we really have done is move to a hazard-based way of thinking. And when you look at the HPD, or you look at what Chris and Meg talked about in terms of chemicals, or what we're doing with LEED, is we're shifting the way we're thinking about all of this to a hazard-based way of thinking, which means that design itself, the selection question in design, is becoming one of the pivotal questions for how we think about health and safety of a building itself. And the other thing we're doing, and I think Charlene's right here, is that we're doing it life cycle-wise, to get out of the trap of thinking the only way an exposure happens is during the point of use. And so I think there's tremendous opportunity here, and I was very excited about the panel because I think it covered all of that, but I just wanted to correct that one little error I thought, and I'm sorry, Charlene, so thank you.
No, you're correct, but then also what's going on is, and you're right, we are shifting our thinking, but the other issue is the building design community is stuck with the laws, the standards, and the codes. And right now, the codes require flame retardants. And flame retardants we know are bad, so what do? And some of the other ones that are coming out have resulted in unintended consequences. So it's a gigantic issue. And yes, it is an opportunity. It's a great opportunity. But you have to, containment still may be the best way at certain times.
If I could just add to that very briefly, I would say that I completely agree. And also, there are two responses that are going on right now, I think, to exactly what Charlene is saying. One is, let's look at the codes and see what makes sense, and whether we need to require flame retardants against concrete below ground. And shifting some of those, and that's already started to happen. And the second place is that people have started to take a functional use look at some of those functions. So they say, okay, we need flame retardant C. Does that mean we need flame retardant chemicals? Maybe not. And that opens up a very creative space, and I agree with Ken that that gives the opportunity for innovation of materials that are inherently flame retardant, as opposed to requiring the addition of flame retardant chemicals. So I think there are different ways of looking at the question.
And I also just want to point out as an example, this is exactly the model we're trying for today. It's not only to get ideas from the audience, because you guys are all experts, but to also encourage engagement between the panelists and have conversations between you, but not let them take it over. So that was perfect. Great model. Somebody on this side, how about right here in the middle, the white shirt?
Thank you. I'm Jonathan Hers with the Department of Health and Human Services. I think it's great that the presentations all show the different parts of health and materials and how they all go together. And people had touched upon codes and things like that need to be re-examined. But I would also suggest that LEED needs to be re-examined. And one thing in Ashley's history you didn't mention was, I guess it's a prerequisite, of pre-occupancy air quality, that buildings need to be flushed out. Well, 10 years ago, I asked the question because people in public health community were asking the question, what happens when you flush out body paint, auto body painting shops? It's a healthier work environment for the people inside, but the people in the community have measured negative health impacts. And so I think in a way, what I'm trying to say is how do we change the whole color of the rating system so that people are considering impacts and along the way and not making assumptions that, well, this is going to be a healthy workplace. And that's the beginning and end of that discussion, which has been there since the very beginning.
And certainly one of the things that I think speaks to that is, of course, the fact that we're taking a more life cycle approach to things. So, thinking about flushing things out into the environment as a whole, that's quite holistic. But, certainly by looking at not just what might we be exposing building occupants to, but the workers and the demolition crews and all of that, I think is starting to get at the point you made.
It's also another argument for looking for substances that are inherently safe. Because if you're just thinking about exposure to the occupants, you flush it out into the community. If you're just thinking about the community, you contain it in the building. If you look for something that's inherently safe, then you don't, it doesn't matter who's exposed at what point in the life cycle.
And I know I'm number 3, but I'm going to do it anyway. You're very right. And I actually was involved in a lawsuit that this was an issue, that somebody had a house very near to an auto body place and they were flushing it out. And it's not just lead, it's ASHRAE that this has to be controlled under. Because the ventilation rate procedure says just push it out into the air and assume that there is enough dilution in the atmosphere that there's not an issue. And we know that's not correct.
This person has the mic, and then let's have this side, and then in the red.
Yeah, good afternoon. My name is Steve Dern with the Adhesive and Sealant Council, and I think I counted adhesives and sealants about 7 times across the panel. So we do make some good products. We represent 131 raw material suppliers and manufacturers of both of those product dimensions. So one of the inherent things I think that is on the table and has been for some time is exposure. Exposure versus hazard, and how do you determine risk? And I think part of our industry feels threatened when it's just hazard-based thinking. And so when you think about a 10.3 ounce cartridge of sealant and what's in that sealant, there's about 10, 12 different chemistry types. And as you take that apart, from a hazard dimension, you get one set of data. But when you take that apart from an exposure dimension in real life scenarios, chamber testing, field studies with products like that, you get some pretty interesting information that may conflict with just a hazard-only approach. So if you take the fire retardant example, if you're on a 30-story building and the building's on fire, and you look at fire retardants and the function that they play in intumescent-based sealants. They fill the gap. They prevent the flame and the smoke propagation between wall systems, between floor-to-floor systems. These are significant life safety issues that really need to be considered when you only factor hazard. So I would caution the hazard, the precautionary principle approach with all of this. So I don't know that there's a question in there, but when you say working together of lists, be careful with lists. Hazard only is not a way to get to risk. You have to have exposure.
Great, thank you for that comment. Do we want to move it? Does somebody want to respond, or?
I would just add one thing that I think can be really helpful is thinking about the function that you're trying to serve and allowing some creativity and inventiveness in how you're trying to create that function. So if you're trying to prevent propagation of fire, let's look at all of the structural and material ways that you can do that and see if we can do that function without the addition of chemicals that prove toxic both in their original form and when they're combusted.
So we've had a multi-year dialogue with Underwriters Laboratories regarding flame retardants, and it's a multidisciplinary group of people that have been coming together there we're headed for our 3rd interaction. And I would invite you to join that group. One of the weaknesses in that group, although it's getting much better, is the fire scientists group, who can bring data to that meeting that is really science-based with respect to flame retardant behavior and actual measurements regarding the ability of and the extent to which flame retardants do indeed retard flame. Because we found, for example, with furniture, there are easier ways than chemical-based methods to retard flames. And, granted, airplanes, it's very difficult to use materials to retard flames in the electrical environment of an airplane. But, we're seeking those ways. And that group, I would just encourage you to join that, and we could talk about that.
Economics of it certainly interesting too. I mean, you can have solutions, and this does drive innovation, but at 5, 10, 15, 20 times the cost is something that perhaps part of this group doesn't think about, that the upper part of the supply chain it struggles with. So it's an economics discussion as well.
And health-based. I mean, it's very, I agree with you completely. It's very, very complicated. In an airplane, you know, what level of human health risk are you willing to live with as you're trying to escape a burning airplane? And so it gets very complicated, I agree.
Thank you, thank you. My name is Fernando Arias. I'm with the American Society of Interior Designers. And I kind of wanted to link two different comments in the presentations that Megan and Ashley provided. One, how do we create positive design criteria, was also raised with how do we also create more training for building practitioners. And so I just wanted to open that up a little bit since I obviously represent the interior designs community. And so the Materials and Human Health Summit that occurred on Tuesday at USGBC kind of really brought this conversation to a big platform. I wanted to know what you were thinking about were some new innovative areas for additional training, additional education, additional ways in which the AEC industry could move into to create a bridge between materials health and knowledge and then practice.
So that's something that USGBC has been looking at very closely. We certainly recognize a need in the community, particularly with us putting out these new credits for that additional training. We're currently working right now on a curriculum around the health and environmental attributes of materials. This would be, we're working on a guidebook specifically that the cohort of senior fellows I mentioned has been writing, about 100 or so page document on building awareness of these issues and how to become literate in the terminology and the kind of scientific approaches that go behind these things. So we're looking to release that document at some point in the new year. It will be a publicly available free resource for everyone, and we hope to develop that into some educational modules and eventually a certificate around materials and their health and environmental attributes.
Thank you very much. I really enjoyed your panel presentation. I'm Jane Ward. I'm with the Uniform, I don't know which camp, let's look at Uniform Services University and the Safe Routes to School National Partnership. I had a couple questions. One for Chris. When you talk about prioritizing compounds to test, the testing process sounded wonderful. I'm glad that we have robots that can do 600,000 items a day. That's encouraging because I think we have a lot to look at. But I wonder if you take existing other existing lists, such as the European Union's list, in your prioritization. My other question is for the panel as a whole. We're talking about the health impacts of materials, and it seems to me, I'm a physician, it seems to me that we're very appropriately considering respiratory, both reactive disease as well as the long-term effects, endocrine disruptors, cancer-causing effects. How about antimicrobial, anti-infectious components and attributes of materials? In the last 2 months, I think we've all heard quite a bit about Ebola. I've been involved in some discussions about how do we clean the hospitals that are being sent over to Africa? How do we make transportable buildings that are able to be sterilized? And as well, how do we bring people back in aircraft with cabins that have clean air, indoor air quality components in the cabins? And certainly as people come back to the U.S. health facilities, we need to be thinking even more about the antimicrobial, the anti-infectious agent component of our building materials. So I wonder if that has come into any of your discussion, and how does this apply to existing building stock, not just new buildings? Thank you.
And that was our last question. So panelists?
So in response to your question about the European Union and their approach, they use what's called REACH. It's an acronym which basically means that before chemicals go on the market, they're tested for toxicity. We use the opposite approach here, that really chemicals generally go on the market first, and when they cause a problem, we regulate them later. We are working with them. In fact, I think later this week, we have a dialogue, an ongoing dialogue with ECHA, the European Chemical Agency out of Helsinki, and we're very, very interested in working with them. They're the Europeans, and in cooperation with industry in Europe and many American companies, are collecting hundreds of millions of dollars worth of toxicological data, which presently is proprietary. And we would like to convince them that there is, that they really should have a market interest in that data. It's extremely valuable and needs to be shared widely as we share data.
Well, that was terrific. I think what you can easily tell from the questions in the audience is that this is a very interdisciplinary group, and that was by design. I think the discussions brought up issues about the difference between standards like ASHRAE, which I always see standards as sort of the floor, and rating systems, which are the incentives and the ceiling, and how we really have to raise both. And I think the discussions also brought out the importance that we both need to have better information to not only avoid the negative, but also enhance the positive. And that's going to be a good segue to our session after the break, which is really going to be about performance and trying to enhance some of the positive attributes that we can create in our built environment. So thank you to our panelists. This is when you stand up again. And thank you also to Angela for that great exercise we did. I hope you take that with you. And now we have a break.